Hello and welcome. I'm Chris Carlo, Doctor of Acupuncture, your friendly neighborhood acupuncturist here at the Acupuncture and Herbal Medicine Clinic in Coventry, Rhode Island. I wanted to share with you a common question people have about our services here at the clinic. People often, when they aren't a patient and they wonder what treatments are like and what type of conditions do I often see and treat, and just generally what's it like. So I wanted to kind of convey that idea to you, help you get an understanding of what it's like here. It's not just all about acupuncture. So the way I would describe what I focus on in regards to health is it's more of a natural approach to medicine. I'm trying to help with tools that we have here at the clinic. I'm trying to help the body to work naturally. Okay, so I'm trying to, instead of forcing the body to do something, which sometimes pharmaceutical drugs can do, for example, right? I'm trying to help the body. It has its own rhythms and functions, cycles, and we're trying to help the body to function and have a natural response, whether it be aches or pains. I mean, there's a lot of different types of conditions I focus on. Oftentimes people will think of pain as a common treatment for acupuncture, and that is true. Chronic pain, even acute pain, and all types that you can imagine. Okay, I had a patient one time who I was treating them for back pain, and they said, "Do you do knee pain too?" And I was like, any kind of pain. I thought that was kind of funny. But yeah, all types of pain. The typical ones that I see is sciatica, low back pain, neck pain, migraine headaches, shoulder pain, elbow pain, wrist pain, hand pain. There's a lot of pain with feet, neuropathy, neuromas. There's a whole bunch of conditions in regards to pain. There's a lot of women's issues, gynecological issues that in regards to pain. There's a lot of digestive issues. I tend to focus a lot on digestion because digestion is a fundamental to health. Sometimes people will have all sorts of signs and symptoms. They go into doctors are confused. They go into health professionals are confused. Too many signs and symptoms. But their digestion isn't working, they're not sleeping well, and those are fundamental. And so even if there's a condition that's incurable, but you try to improve on your sleep and your digestion, it's going to have a benefit on your health overall and how you feel. So that's a way to approach, from a natural point of view, medicine and health and healing. Okay, and so digestion is a big area I focus on. There's a lot of people that have food sensitivities that we can identify, and if we can eliminate those and improve digestion, you can eliminate those, then there's less inflammation, less pain, less irritation to the immune system, overtaxing the immune system. People can experience more energy. You need energy for the body to function. Every function in the body requires energy. So that's a big focus. Women's health issues is a big focus. Fertility, the menstrual cycle. There's also a focus on mental emotional issues like depression, anxiety, for example. So there's quite a wide range of issues. I've had people come in with Bell's palsy, which is a kind of a paralysis on the face, a nerve condition often experienced where people will, struggle with that sometimes for months. And the sooner you can get in on any particular health issue, the better, I think, and faster things can turn around and heal for you. One thing that people don't realize is when you have something that happens, say it's some kind of trauma, and the body starts to create inflammation. If you can get in and help that inflammation cycle to stop, you can speed up the recovery. Okay, a lot of times that inflammation gets soaked into the tissue and it ends up staying there and it doesn't heal 100%, and then the person ends up with like a long-term chronic kind of condition of pain or stiffness or lack of mobility. Frozen shoulder is a good example of that. Okay, so a lot of different conditions that I work with. Sometimes people will ask me about their children. Now, I don't tend to insert needles into people who can't sit still. Sometimes there's adults who can't be in a certain position for too long. They're uncomfortable. It makes it challenging. We have to figure it out. Sometimes I'll treat somebody in a chair or laying on their side or their back or face down. We try to find ways to treat where they're the most comfortable. A lot of times patients are just falling asleep on the table. When I'm doing a treatment, it's very relaxing. But children, if somebody had some issues with children, even young children, there are pediatric tinctures. These are like prepared remedies that can be helpful: constipation, diarrhea, irritability. Sometimes helping with sleep, this sort of thing. Simple little things when you're dealing with children. Sometimes a child is off health-wise, and if you can get them to sleep better, or help them to relax a little more, or help with digestion, that's a big one. Colic, for example. Even older children or teenagers, for example. That teenagers a little easier to kind of talk with and lay on the table comfortably. Usually the routine is you would come in for a treatment. There's an evaluation that we would do that helps me to form a treatment plan. Some people have asked me over the years, can't we just do treatment, skip the evaluation? I'm like, can the mechanic fix your car without trying to figure out what the problem is? Let's just change the muffler. But it's something to do with the engine. Just change the muffler. No, we need to diagnose, right? We need to sit down, talk, look at your health history. This is the proper way to make sure we zero in on the right health issues. I had a patient one time come in, elderly patient with stomach pain. And she had all sorts of tests done where they scoped her stomach to look around, and they couldn't find anything. And she was going on for months with this. And I didn't even really need to do acupuncture so much. When I heard about her diet, I realized she needed to correct that diet. And I told her a very simple idea of correcting her diet, and she went home, and a week later she came back and she had no more pain in her stomach. And she was running around to all sorts of specialists and such, gastroenterologists and such to try to figure out what was going on. And there was a diet problem causing, the stomach is kind of it's an environment. Sometimes it could be too hot or too cold or too damp or too dry. That's how we look at the body. And when we see certain things, we try to bring balance. If it's too dry, you try to moisten it. If it's too wet, try to dry it, right? This is yin-yang stuff. So it may seem kind of funny, but it's kind of basic understanding of nature, really. So anyways, just, let me back up a little bit. Sometimes, like on my website, I have a request form for a free consultation, and you can find it at the top of the website, natureshealing.info. And oftentimes, that's what people do to connect with me. Sometimes people don't want to commit to just an official treatment and schedule an appointment and take the time out of work or whatever to come in. They want to kind of get a better understanding because it is a little alien to them, perhaps, thinking about acupuncture and what we do here. And like I say, it's more than acupuncture. We deal with diets, and there could be food recommendations, there could be herbs and supplements, etc. So I get into Tai Chi and Qigong and meditation. There could be stress management tools. But people will first oftentimes contact me through the free consultation request, which is on my website, or people will find me through Facebook. And basically, I'll get an email. It's requesting a free consult. So I'll send them a couple of appointment times. And then they'll pick one, they'll write back. And you see, this is all by email. It's kind of very easy, you know. You're not on the phone, on hold, or waiting, or trying to find the right time to connect with me and all this. Just shoot an email, wait for a response. You know, baby steps, right? And then they pick a date. I put it in my calendar, I send them a reminder, and I give them a short little one-page form that they can fill out outlining their health concerns. Then we meet and we talk for about 15-20 minutes. It's not long, but it's just enough to understand the health concerns and see if this type of medicine is going to be a good fit and answer any questions the potential patient may have about the therapies that we use here and what to expect. But that's partly why I wanted to do this video as well, to help people understand. So once we do that free consult, you know, we can schedule an appointment. Some people are okay, they just schedule an appointment, they don't need the free consult. It's up to you what you want to do. But we'll schedule an appointment. Usually the first appointment's about an hour and a half. We need to do evaluation and then treatment. Treatment's about an hour. The evaluation's about a half an hour. Follow-up visits, because this is a therapy, so oftentimes people may are going to come weekly in the beginning. You know, the more we can treat and I can stimulate the body, it's like a snowball effect. We get some good momentum. You know, the acupuncture helps stimulate the body's circulation and production of certain natural chemicals for body function. For example, like endorphins for pain, or ACTH, which is a precursor to cortisol for inflammation. You know, so stimulating the body, helping the body produce this effect, it's a healing response, really. And when you think about blood flow and how important that is, every cell needs to eat, breathe, and it makes waste. And the blood flow brings in the food and oxygen and takes away the waste. And when that flow is obstructed, impeded, blocked, impaired, however you want to say that, then those cells will suffer because they're not getting what they need, and toxins will build up. A lot of times people are thinking, well, I'll just avoid eating toxins. Good luck. We're surrounded by toxins. I mean, our clothes are giving off gas that we can't even see that's producing toxins. It's all around. What you want to do is help the body eliminate the toxins, you know. And that's, you know, hydrating, having a good diet, good elimination, helping the body, sleeping well. This is all going to help the body to function well so that it can do its job, and one of them is to eliminate toxins. But that circulation is important, and acupuncture can help stimulate that circulation, and there's usually weekly treatments until we start to see improvement. Maybe we spread out the treatments a little more. Some people need more, some people less. That's the basics. Usually a person will come in and within an hour we do a treatment. So you come in, we may catch up a little bit, talk. Person lays comfortably on the table. I like to let them relax for a few minutes, let their muscles relax. Sometimes you come in, you kind of have tension in your body. You lay there for a little bit and the body relaxes, and that's a better treatment. And I try to look for those sort of things. It's not just jam them in there and on your way. I think it's very important for patients to be comfortable when they're here being treated. Very important. So that's half the battle. Sometimes they can't get into a comfortable position at first. I remember a patient who came in and she was all curled up in like a ball on the table. I mean, she just could not get comfortable, and after a few weeks of treating, she was able to lay in a more regular position. Because she was more comfortable, we were able to reduce the pain quite a bit. So a lot of different challenges just in the, sometimes in treatment, and I want to just make sure people are comfortable. So once the needles are inserted, and sometimes, people will ask, how many needles do you often use? I've been doing this for about 20 years, and in the beginning I used to use somewhere between 12 and 20 needles. That would be, I'd say, a common number. But I've recently last maybe 5 years or so, I've gotten into electric stimulation. So this is called electroacupuncture. You can do some research on that, find out more. But it's a way of, again, stimulating the body's natural healing responses. And I use that, and it's a very gentle stimulation. It's not like TENS where you get a big vibration. It's kind of pinpoint and mild. And when I use that, I can use less needles. Oftentimes I only use 4 needles. And I like this path therapeutically for my patients because 2 things. One, there's less needles. And there are some people who are kind of needle sensitive, and they just the thought of needles makes them uncomfortable, okay? And so, having 20 needles inserted, that's going to be maybe a hard thing to kind of deal with for some people, which, again, everybody's different. Mostly, oftentimes, people don't even feel the needle. Everybody's a little different. So people will lay there. I've had people fall asleep on me before I was finished treating. I was still inserting needles. I felt like, I got to keep this person awake, so, I want them to be aware of what I'm doing and all, and give me a response if they need to. But it's relaxing. It's a relaxing way of experiencing treatment. But, I chose electroacupuncture, less needles, more comfortable, and more effective as well. The electric stimulation is like a second treatment on top of the acupuncture itself. It's like you're getting a 2-for-1 therapeutically. So needles are inserted. It takes a few minutes to do. Depends on the condition. And then the patient lays there for about 20 to 30 minutes comfortably. Sometimes people will fall asleep. Then I come back in, take out the needles. Sometimes conditions require like manual therapy or manipulation, some kind of massage technique, stretch out muscles or something, and that might be applied. There's a style of massage under traditional Chinese medicine called Tui Na. It's kind of like a push. The Tui Na is actually a movement in the form of massage that is done. It's a way of kind of like pushing the muscle or stretching the muscle. So that might be added into the treatment. It just depends on the condition. And then the patient gets up and the treatment's finished. Maybe we schedule more appointments. Just depends on the results and how people are doing. Sometimes people have come in within a few sessions, big changes, very helpful. I also give a lot of self-care tips, meditation, stress management, simple breathing techniques. You don't have to go to a temple, cross your legs, and meditate. You can just be driving in the car and do a little simple breathing technique that can help you to relax, believe it or not. I'll give you an example. When you inhale, this energizes the body. When you exhale, it relaxes the body. How do I know this? Think about, we don't even have to do research, okay? Just think about how you feel. When you're excited, do you breathe in or do you breathe out? You're excited, you, right? That's like energizing, exciting, right? When you relax or you sigh or you finally find a solution to something and you finally exhale because you're settled, you're relieved, and you go, right? So the exhale is relaxing. And so if you're looking to help relax the body, you focus on a nice, long, intentional exhale. Why? Because oftentimes we're filled up inside with energy and we're holding our breath in a way with stress. Our breathing is shallow. And if we can empty, then it gives us some room to breathe in. Okay? And there's more about stuff like that. I try to individualize these self-care techniques. It can be very helpful, though. So I hope this gives you an impression of like an acupuncture treatment. I threw a lot of stuff at you. You can find out more on my website, natureshealing.info. You can request a free consultation, or you can just get in touch. Give the clinic a call. You can find all that contact info out on the website, natureshealing.info. You can also chat me up on Facebook. I throw a lot of posts and articles and videos out there that I hope is informative and instructive in regards to how to take care of your health naturally from a self-care point of view outside of the clinic. Okay? So until next time, take care of yourself, and remember, your health is your most important asset. Focus on it, take care of it, okay? And keep on the sunny side.